So EMDR is an integrative psychotherapy, or something that we might call power therapy. It stands for eye movement, desensitization, and reprocessing. And originally it was a strategy designed to help people with traumatic experiences.
One of the things I like about EMDR is it's a very powerful form of therapy, and it's a very efficient form of therapy. It's one of those things, we recommend it because it works.
EMDR is one of those therapies that many people try to understand what it is before you come in, and it's really hard to find a good description on the internet. Most people describe EMDR in very scientific methods. So I'm going to try and describe it a little bit differently. Basically, you come in for EMDR, and through bilateral stimulation, that's either touching on predominantly the hands or through the eyes, the therapist is going to help you deal with whatever issue you're facing, usually a traumatic experience. So by using bilateral stimulation, it's like our whole body is engaged, so then our whole brain is engaged. The way I think of it is, it's like all the streetlights are turned on inside of our brain. So when we're dealing with a difficult issue, it becomes much more quick to move through that piece and to desensitize the emotion and reprocess the thinking.
One of the cool things about EMDR is we can use it on any age range. We can start with very, very young children, and when we do that, we have parents help with that process all the way up to adolescence and into adulthood. It can help anyone.
When a difficult incident happens in our life, it's kind of like when you bite your cheek. So when we bite our cheek, our tongue keeps moving over, trying to touch our tongue, seeing what happened, what's going on with these cells, they're damaged. Trauma in our brain is very similar. There's a difficult situation. It could even be someone rolled their eyes at you today and you just can't stop thinking about it. The brain keeps going back and touching it. It feels uncomfortable when the brain touches that memory, and so it just keeps going back. This doesn't feel right. EMDR helps the brain to be able to touch that memory with desensitized emotion and reprocessed thoughts. So when the brain touches it, it can say, wow, I believe that happened, rather than what the hell happened.